This is the talk show that takes a no-holds-barred approach to politics, where truth and integrity are the standard and the Constitution honored. From Renaissance Studios, this is Champion News Talk Radio.
Good morning and welcome to another great edition of Champion News Talk Radio, brought to you by championnews.net, your choice for the conservative voice. Today, our founder, Jack Roser, and myself have healthcare expert C. Stephen Tucker with us because of this current ruling that happened on Thursday morning. Good morning, Jack. Good morning, Mr. Tucker.
Good morning.
And Wednesday was a very sad day for America and Americanism and the America that we know and love.
Steve, what makes you, pardon me, what makes you so smart about this whole thing?
I've been doing this 17 years. I've been a health insurance broker, and I insure people across the country, 10 different states. And so prior to the passage of Obamacare, I know health insurance law. And so I saw every lie that he told before it was passed, the lie about pre-existing conditions, the lie about the 45,000 people in the country are dying every year because they have no health insurance, the lie that if you're denied for health insurance, you are left with no options, another lie. And then his blaming the insurance companies for pre-existing conditions, when anyone who knows HIPAA law knows that in 1996 we passed HIPAA portability law, which states that if you have a group health insurance policy and you maintain that policy for 18 months and you lose that employer-sponsored coverage, you have 63 days to find another policy. If you find another policy through an employer group, they have to cover all your pre-existing conditions. All employers know this, and this law has protected 90% of the American insured for 16 years. So the reason we have pre-existing conditions is because when Congress wrote HIPAA portability law, they extended no portability protection to individual policyholders. So these are not, this isn't Motorola, who can go with 500 employees and tell Blue Cross Blue Shield of Illinois, our check to you will be $120,000 a month to insure our 500 employees. We just got a quote from Humana and United Healthcare. What are you going to do for us so that you can get that monthly check? And underwriters will actually bend over backwards and rework plans and rates to get that check. When you're a self-employed person, you're an independent small business owner, you don't have the purchasing power. Those are the people who should have been given portability protection against pre-existing conditions, more so than the others.
Which is also the backbone of the economy. Let's be real.
Exactly right.
That's the backbone of our economic driver.
14 million Americans now that it has grown to, self-employed, independent small business owners. And they can be denied coverage for pre-existing conditions. They can be too heavy to get underwriting done and get an individual policy. But when Congress dropped the ball in '96, the states picked up that ball and opened what's called high-risk health insurance pools. In Illinois, we call it our Illinois Comprehensive Health Insurance Plan, ICHIP. And those kinds of programs, whether it was a guaranteed issue individual mandate or it was a high-risk health insurance pool for individuals who are too sick to get health insurance, those have been around since 1996 in 45 of our 50 states. Brilliant concepts like Ohio. Ohio's insurance department says that if you are uninsurable, you're sick, you're an individual, if you're an insurance company that comes in our state, and there are 20 of them in Ohio, you want to sell health insurance here, you have to give 4% of your block of business on a guaranteed issue basis during an open enrollment period once a year of 30 days to anybody who needs coverage, no questions asked. Ohio has never maxed out 4% for each carrier because when United Healthcare fills their 4% quota, they notify the State Department of Insurance that we now have filled our 4% quota for sick people. Now we're going to send that ball on to Humana. Humana will offer 4% of their block of business during a 30-day open enrollment period.
So it keeps the health insurance companies balanced so they're not top-heavy on sick people. Right. And it helps disperse and
everyone
equalize.
In Ohio has coverage for pre-existing conditions. That's just one example. That's just one. What Obamacare did is it ignored the fact that we already have state-based solutions for people with pre-existing conditions, and President Obama came in and started his own federal health insurance exchange. He put $5 billion into this new pre-existing condition plan, which then usurps states' rights, right? And now the people who are sick, who have been on these high-risk health insurance pools, who pay a lot more for their health insurance because only sick people go to these risk pools, they got no premium relief from the federal government to lower their premiums. And they couldn't get on the new federal pre-existing condition plan. Why? because Obamacare says you must wait 6 months. You must be uninsured for 6 months to get onto the new federally subsidized risk pool. It was ridiculously incompetent the way they did it. And Plato said years ago, centuries ago, the penalty for not being involved in politics is that you will be ruled by your inferiors. And this is what's happening with Obamacare.
Like my father-in-law's favorite word, ineptocracy.
Ineptocracy.
We're going to be living in we are living in ineptocracy.
And it's not rocket science to fix these problems. It's very simple.
But Steve, you know what? This law was deemed constitutional on Thursday by the Supreme Court. This was something that many Americans were waiting for. Most of Americans do not want this law. How did it happen that this got through as a constitutional piece of legislation?
Well, first of all, it was not allowed. Justice Roberts ended up agreeing with the liberal left on the Supreme Court. We have not been able to trust the Supreme Court since the 1930s. We've had 40 years of progressive appointees, progressive liberal appointees. And so our majority, which was slim as it was unfortunately able to stop this from happening. Roberts protected the Commerce Clause. Remember, the whole argument is that the Commerce Clause, under our Article 1, Section 8, the enumerated powers, states that the government has the ability to regulate commerce. What Obamacare tried to do, and eventually, thanks to this decision on Thursday morning, they now are allowed to compel commerce so that they can regulate later. Well, Roberts said, I disagree. The government does not have the power to compel commerce and regulate it later. But I must agree with the liberal justices Sotomayor, Kagan, and Ginsburg that Congress still today and always has had, under the Constitution, the ability to levy taxes, levy fines, levy penalties. It has done it for decades. So all he said was, I do not agree that the Commerce Clause allows you to compel commerce so you can regulate it later, but I must agree with these liberal justices that if you don't buy health insurance, the government can and will impose a fine and a penalty.
But wait a second, didn't President Obama himself say there will be no new taxes because of this law?
Oh yes, one of the few bright lights of Thursday's decision is that the Supreme Court confirmed that Barack Obama is a liar. Because he said, you have to, this is a tax, right? They argued that it was a fine and not a tax. And remember, he did that interview with George Snuffleupagus on ABC News? And Snuffleupagus pulled out the dictionary and said, hey, Mr. President, you're saying it's a fine, but what you're doing is a tax. It says so right in the dictionary. And President Barack Obama said, and I quote, I reject that definition. So throughout all of the oral arguments and to the public, Barack Obama said this is not a tax.
Right.
Why did he say that? Because he promised to do what?
Not raise taxes.
Not raise taxes. And this is the biggest tax increase in U.S. history. And thanks to the Supreme Court justices, it is now going to go forward unless we stop it. And we can only stop it by taking the Senate and the presidency. Remember, this legislation was passed with the reconciliation bill. The reconciliation bill requires only 51 votes to pass a piece of legislation. Mm-hmm. So for us to defeat this legislation in November and overturn it and repeal it in 2013, we must have at least 51 votes in the Senate.
But here in Illinois, we don't have any
How many
Senate
more
seats
senators do we need?
We have 23 Democrats up and 10 Republicans up. So we're going to win, I believe, enough. I was worried about the 60 seats because I figured it was filibuster proof. It is not. We'll use a reconciliation process the same way they passed it. Mitt Romney has committed, and I quote, on my first day of being elected, I will issue waivers to all 50 states, and I will repeal this law the same way that it was passed using the reconciliation bill. So,
Steve, one might question why we're so much against this law with the federal government compelling control of the delivery of medical care.
Right.
And what it really does, it flies in the face of the kind of country we've got. Can we make our own individual decisions
right.
about the things in our life, or is the government going to make them? Right. People haven't really thought about what they lose in freedom if the government is going to make the decision.
That's right.
Because inevitably what happens is you get taxed. It goes through a very inefficient process with a bunch of overpaid or unresponsive
bureaucrats.
Yeah. And with a subtraction from the cost of all of these people, with their disconnection with the process, their non-responsibility for being right about anything, because these bureaucrats aren't even responsive to the vote.
That's right.
So you got this whole bunch of irresponsible, overage kids that are handling your decisions about what kind of medical care you're going to be allowed to have.
That's right.
Now, I understand for one thing, I'm 88 years old. Under this, I'm not going to be able to get any kind of treatment by the government if beyond age 75 of, that might cope. Could I get an artificial knee that I think I will need? One is already. Will I be able to get an artificial knee at age 75? Probably not.